So today we're going to discuss a little bit of fine motor, because I know most of us, wherever we are now with our children. And when we are with them, when they do their coloring, when they do their dot to dots, when they do their activities, we're actually with them and we're able to see how they are able to hold the pencil, use the scissors. And there are moments as parents you go like, I didn't know you hold your pencil like that, or I didn't know you hold your scissors like that. So it will be just a brief one to be able to tell us what is fine motor and some nice tips that we can use at home and ideas and activities we can do to be able to help our children and youth. If you have a youth who still have a fine motor challenges or have fine motor challenges, to be able to know how to work with them. So feel free to send any questions as I continue with the chat. I'll be able to answer them as I see them. So, by and large, fine motor, because the word fine motor, if I can just break it down, it is how we use our fine muscles, or we can say muscles of the hand, like the really intrinsic muscles of the hand. So it's using these muscles that are here and collecting to these parts of the hand, plus your wrist. So how we use it, that's the fine motor. So gross motor is the big muscle, big movement. So the big movement of throwing and catching of a ball, that requires big movement. But when it comes to the writing and the drawing, that one is really fine. So it's small movements, okay, that requires small muscles. So it comes gradually. So when you see a 12-month old holding a pen, you'll most likely see them having that grip. So you find that if you give them a pen or something cylindrical, you will get that. So they'll be able to hold it like that. And then when you have an 18-month-old little one, you find that they go to that. They will go to that kind of grip. So they'll automatically just have that grip. So as they progress, they reach around 2 years, you'll find they have that form of grip. So they're holding, the fine is really coming a little bit. So you'll have that kind of grip. Then as they grow older, you'll find that they start having like a small, like that, a little bit. So they use all their fingers to hold. So they're able now to hold much thinner items or much smaller items. And then with time, they progress to that grip. So it's way high. So we call it a high grasp. So they go all the way up there. So they hold the pen like that. And at times it's with all the fingers. And then as they progress, it goes a little bit lower. And then when they reach to around age 6, 7, we go a bit lower. So they're able to have that. So you find that now, as they grow older, they now refine the fine motor skills. So that's why you find that as they grow older, they're able to pick small beads, they're able to pick small items, they're able to do and draw, and even hold small paint brushes like this one. So that's when they grow older. So you find that it's quite progressive. And for a child who has any form of delay due to whatever cause, it might be due to a condition, it might be due to uh, just a delay. There are children who just delay, no known cause, they just delay. So, in case of any delay, you find that a child might still be at 3 years, a child might be 3 and they still have this grip. Okay. So you find a child might be 6 and they still have this grip. So if they have a form of delay, you'll find that they might still be they might hold their pencil at a different or at odd way. So we have that part of the fine motor. So we have the grip. So grip and writing is part of the fine motor. So you find that when they are at around 12 months, you find that they mostly do dots. So you find they do a lot of dots when they're small. They're 12 months old. They'll do, when you give them a pen or a crayon, they'll do lots of dots. They just do dot, 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 because that's what they can be able to do with the movement. Because remember, for them, the movement is shoulder, coming from the shoulder. So they don't have still fine motor. So the dot is a very nice one because the movement is actually you get them moving their hand from the shoulder. Then as they progress, you find that they now start having horizontal scribbles. So at 18 months, you'll see them doing lots of horizontal scribbles. So they'll scribble, 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 more of horizontal. Okay. Then the next one you find at around 2 years, you'll find they'll have the circular scribble. So they'll have that circular scribble. So they do the scribble, 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 but in a circular motion. Then as at age 3, you'll find they'll have that vertical scribble. So they will draw lines either straight or that way or diagonal. They will start now having that kind of movement. Then they move to rings and dots. So you find they start drawing rings and dots, drawing rings and dots. So it slowly progresses as the grip progresses. So you remember the grip keeps on changing. So when the grip changes, it allows them to have some fine movements with better coordination. Then at age 4, 5, you'll find that they now start imitating cross shapes and things like that. So when we now start coming to the imitating and drawing, you find that we see at age 2, they start having they're able to draw some lines. Then at 2.5, you find that they're able to draw that kind of line. And then you'll have the square, the circle, and then at age 4, at 3.5, they'll be able to draw a plus. Then we go to the X, and then at 5 the triangle, and then the diamond from age 6 and above. So you find it's quite progressive. So you find the children, that's the development stage they are in. So you can imagine when you give a 2-year-old letters to write, actually it is quite a daunting task for them, because they are not able to, because their muscles are not ready. Because I remember there's a time I posted about why we shouldn't make our children write early. And it was a very interesting discussion, because people, some understood why they shouldn't write early, but some were like, even as we started writing early, so I don't see the need of a child not to start, not why I should delay my child to start writing. But as we can see, the fine motor is sequential and development is per age. So a 2-year-old and a 3-year-old, telling them to write or making them write is actually, you're not helping them, because they are not yet there in terms of development. So I always opt for writing coming at a later stage, not too late, but a little bit later, from age 5 onwards. So when we introduce the letters and the alphabets, they have already learned some pre-writing skills that will enable them to be able to write. So then when we now look at that in terms of writing and the grip and the grasp and things like that, for the children who are have a slight delay in their fine motor, they will struggle to hold their pencil and they will struggle to get that coordination. So there are various forms of grips that that facilitate for a child to be able to hold their pen nicely. So I'll just show you a few of the grips I have and what they do. So for a child who's having a problem with when they are really young at age 3 and they still have this form of grip, so this one is one of the grips to be able to facilitate them to have at least the next step, the cylindrical grip. So we use this grip to be able to help us do it. But if you don't have access to such a grip, the best way is to adapt it using Play Doh. You can use Play Doh and stick it up and make it into a ball, and it actually becomes this form of grip. So this one would prevent the child to have that grip, and it will just be able to facilitate that kind of grip. Another thing that you can use is the patty. You can use patty to be able to adapt this, to make this type of grip. Another thing you can use is you have this styrofoam. You can still cut it out in a way that the pencil will poke it through and then you shape it. So you can still adapt it. So you can still make this out of various items. Another form of grip is this one. So for this one, It just helps the child just hold that. So this type of grip and this one is also another one. So there are various forms of grips, but you can always try and adapt. There are children who go for textures. There are those who feel some textures are too soft, some feel they are too hard, some feel it's cold. Interestingly, there are those who tell us the grip is cold. So it goes per child and per their preference. Then another form of grip that also helps the child as they progress. So this one is just to be able to help them hold the pencil nicely. So this is another one. So they just put in their fingers and then they're able to hold the pen. So for this one, for younger kids, I find them struggling to hold it. But older children from age 7 and above, they find it a little bit easier. But for the younger ones, this form of finger movement and the fingers being differentiated like that is a little bit hard for them. So those three types of grips, you can always adapt them with a peg. A very simple adaptation. So you just take a peg and then you clip it on the pencil and then they just hold it. So you find that they're able to have that. Hi, Jacinta. So they're able to have that. So they're able to have that form of grip with the peg. So you put the peg, then you have adapted it. So it gives you that pincer grip. Then another form of grip is the weighted grip. So we have one that has a weight. So this one just helps them with the motor coordination. Motor coordination is the skill you have when you're doing a maze, a dot to dot, something that will require that fine movement. So for a child who has very shaky or very light, they don't press a lot on the paper, or they press too much. So this one will be able to help them. For the children who have tremors during writing, because there are children who have like tremors during writing, it is recommended they have a grip so that it helps them to stabilize a bit and to be able to do a bit of the writing. So these are the grips that you can always find or you can adapt. So for the weighted grip, I've always seen parents adapting using some screws. So they get screws and they're able to adapt it to make it weighted. So you find that the pencil grip actually makes a huge difference. So when a child is able to change their grip, they're able now to do much more work. Because a grip that is wrong makes the child really tired. So you can imagine if you're to write the whole day with your pencil there. So if you just take a pencil, if you're near a pencil or near object, just take it and write. Try writing one sentence or two or three. You'll find you'll get tired so easily. So you find the grip is so critical. So as a parent, as a guardian, just take time to see how your child constantly holds the pencil. Because something very interesting with grip is that the children change it frequently. So one moment you find they're holding it really nicely, the next one you find they have that, the next one you find they have the high grip. So it's always nice to just monitor your child as they write. Just keep on looking. What are they doing with the pencil? How are they holding their pencil? How are they able to hold their pencil? So that is one aspect of fine motor. Any questions, please raise it up. Raise your questions even as I progress with the video. I'll be very happy to answer. So one aspect of fine motor is the writing. And that's the one we actually interact with a lot when we work with the children in school. It's actually highlighted as one of the main one. Why we get the calls as therapists, excuse me, just come look at our child, their writing, their grip is off. So when we go to the child to the class, we actually observe how they are holding their pen, even when they come in for assessments. That's what we look at, how they're holding their pen. Another aspect of fine motor that is quite critical for a student in school is the cutting skills. How are they able to hold the scissors? So, still age based. When a child is around 12 months and 12 to 15 months, you give them a piece of paper. So, if this was the paper, this was the scissors, higher the chances they will just tear it. They will not really have that open and close and things like that. So for age based, for 12 months, 15 months, it's just giving them the scissors to, it's still the plastic ones would be good to just help them to be able to just have that skills and to be able to just learn to open and close and things like that. Because this one still requires a lot of coordination. So when they reach 18 months, 18 months to 2 years, that's when they start making a cut. So they're able to snip. So 18 to 2 years, that's when they're able to start snipping. So it is encouraged to let them just start, now just start trying. They just start trying to use the scissors. Just help them try, give them the safe scissors, 18 to 2 years, 3 years. We have these ones that are plastic and these ones that leave this they will leave this ragged edge on the paper. For the young ones, they are so impressed with this one. They always try and imagine as if it's a crocodile. So you find that when you introduce them to this form of scissors, it is very nice. So when you introduce them early, it just gives them the fine motor precision. So fine motor precision is that fine movement that you actually get with practice, because fine motor is all about practice. It's just like the gym. The more you go, the better you become. So fine motor is the more they practice in the right way. Because even in the gym, you'll be told, please put your back straight. When you lift the metal up like this or the weights like this. So even with the children, we just have to ensure that they have the right grip and the right activities as per their age. So that's why I would actually run away from giving a 3-year-old to copy letters or to write sentences, because that is not age appropriate. It's, yes, it's a good activity, but it is not age appropriate. So with the cutting, as they progress, then you can move to this type of scissors. But if they really find it very hard, just look for adapted scissors. You find for the adapted scissors, they have like, the child doesn't have to cut all through. That some of the adapted scissors have more more spaces for them to put their fingers. So you find that it might even have 4 slots for their fingers, or they might even have just a spring and a connector where they have to just press. They don't even need to use their fingers much. So if they find cutting really hard, I would go for the adapted scissors. So cutting is integral. So let them just cut safely. Observe if you are with them. Monitor them as they cut. Look at how they hold the scissors. Look at what scissors you have. There are some types of scissors that might be very hard for the children to operate, because you see, like, there are those that like require a little bit more of energy. So just check if you have scissors that are hard for them to use. Simplify it for them. Use a little bit of more flexible scissors, that the child can be able to, or scissors that are moving quite fluently. See, like this one is getting a bit stuck. So also observe the type of scissors they have, but monitor if the child still cannot, even if they're older. There are children who don't observe, where their eye-hand coordination is still not good. So eye-hand coordination is how you coordinate your eyes and your hands. So there are children who, when they're cutting, they are not so careful where their fingers are. So even if they're much older, still scissor safety is important. Ensure that if they ensure they're able actually to have that eye-hand coordination, and they can actually look, because there are those who get distracted. They look on a different side. They're cutting but looking at a different side. I wouldn't go for such like scissors. I would go for the plastic ones. So practicing cutting is very important, but still it's progressive. So I would start for children just with the cutting and snipping, just getting them to cut and snip a piece of paper into pieces with no particular order. And then now we move to lines, cutting along one straight line, then cutting along a curvy line, and then cutting along a zigzag line. So make sure it's progressive. Don't start with shapes and pictures. Just start slowly. Let them snip, let them get used to the scissors, let them see how to hold the scissors. And some get tired. So if the child says, I'm tired, or they want to take a break because of the the fine motor muscles are not developed, just let them have the break. Don't push them into finishing the scissor activity. So that's one with this. So we're finished with the holding and the grasp, and then with the scissors. So we'll move to dressing. So how does fine motor come to dressing? So with the dressing, you find that we have the buttoning, the zipping. So with zipping, it's quite easy. This one is one fine motor that you find very easy. For the children, they don't struggle that much with zipping. But the one that they find challenging is with the buttoning, being able to button big buttons and small buttons on themselves. So with the buttoning, what I can say is that if the child has not yet gotten to a place to learn how to button, try make them button uh, something outside their body. Like, for example, if you have the chair, just put the sweater around the chair and let the child try and button. Start with big buttons, moving to small buttons. So, buttoning is a skill the child learns by seeing. Let them see you button. They look at you buttoning and they see you buttoning. It's like a reflection. So, you help them have that reflection. As they progress, let them look at the mirror as they button. So buttoning is a skill that is still practice based. So they have to practice to be able to learn how to be able to button. Then the zip is very easy. For many children, it's zip. So if they can have clothes that either maybe has less buttons, if it's school clothes, if you can adapt, let them have clothes that have less buttons or bigger buttons. There are schools I know they don't mind having that particular child having bigger buttons, slightly bigger buttons. So with the zip, it is nice. They're able to open and close their zip. So with the dressing, we can actually summarize as that. Let them do it on. There are those who prefer doing it on a doll. So you dress the doll, help them button the door, or help them button the jacket on a piece of chair, or even just having that button movement on, because there's those pre-buttoning skills where you just pass the button along. Another thing that can be nice to do is the threading, because the threading along the beadwork is something that requires that both use of both hands. So it's a skill that will build up on the buttoning. So where they're able to use both hands to be able to do a movement. So it will be able to build up to buttoning. So the buttoning, the closing of zip, then another one where fine motor comes is the feeding. So feeding that fine movement. So we have the finger foods where the children start with the finger foods, just eating the finger food. It's very important that the child is able to just hold and try. If they haven't, if they have done the finger foods, just go to the spoon, and then with time, it's not bad to try the fork and knife. Just try it, even if it's with the plastic one. Just try so that they have that movement of both hands. So the fork and knife, you can try it in fun ways where you can do cutting of a sandwich or things like that. So the child is able to just use their fork and knife, or cutting something on a piece of plate, cutting it to a smaller piece. So it's just those fine motor movements that would be nice to have. So fine motor in a nutshell, if you're working with a child who's having fine motor challenges, having a problem with them sitting and doing work, I would start with the activities that would encourage them to just do something with their hands. So if it is playing with patty, playing with Play-Doh, let them have that warm-up activity. So if I was to put it in a session, I would start with a warm-up activity where they're able to play with Play-Doh, able to mold it and things like that. They just roll it up. If it's cutting, they cut, we roll it into a sausage. They cut the patty or the Play-Doh into pieces. And then we now move to the motor coordination activities. We would do something like dot to dot, where they do the motor coordination activity, starting from 1 all the way to 10. Some go to 50. For the older ones, they even have dot to dot activities that even reach 1,000, like 1,000 and something. So it's all age related. So you get to know what your child knows, get to know which numbers they're able to remember and recognize. Then that's the dot to dot work you'll give them. Then with the mazes, also still age appropriate for the small ones, or for the ones who haven't yet gotten to work with mazes. Let them do big mazes. Let them do big mazes that they will be able to do. Then progress to much smaller ones if the child likes the mazes. So progress to smaller ones. So for fine motor, what I can say is that whichever way, make it fun and functional. So, and make it and always change it, because there's a challenge with children. When you keep on repeating activities, they won't like it as much. So every time you're doing fine motor is always beading or threading a number of beads. So keep on changing, keep on shifting the activities, but make sure it is fun and functional. Fun and functional. So if I can put fine motor in a nutshell and the various adaptations, for the fine motor, for the dressing, for the grip, for the scissor skills, I can summarize it as that. Would like to know if there's any questions regarding fine motor, any questions regarding fine motor. Yeah, so the Play-Doh is also, you can do various activities with the Play-Doh. You can even make your own Play-Doh, then now do the various activities with the Play-Doh. It can be cutting, it can be hiding items inside the Play-Doh where the child has to find it. It can be poking the Play-Doh with toothpicks. So anything that will have that fine motor. Another one that is very good with fine motor is painting. So this one is like really the tiny brush, but you have bigger ones. So go as per the grip of your child as per the moment. So if they are able to hold the big pencil brush, go with the big pencil brush. But if they are just here, just move with the pace where they are. So let them do painting, let them do drawing. So go as per also the interest of your child in regards to fine motor. If they like mazes, go for mazes. If they like dot to dot, go for dot to dot. If they like drawing, give them things they're able to draw from observation where they copy. Let them copy. So also let it be interest based if possible. If the child has a particular interest, let them follow and do the activity as per their interests.